Picture this with me. It's a quiet Tuesday night. Your Great Dane is happily licking his bowl after dinner. You join him on the couch, flip on a show, and everything is exactly the way it should be. Then, somewhere deep in his giant chest, something shifts. Without warning, his stomach balloons with gas, rotates on its own axis, and locks shut. Within 30 minutes, he is pacing, dry heaving, gagging, drooling foam, and his belly is swelling up tight as a drum. By the 60-minute mark, his organs are starving for blood, his heart is racing, and he is going into shock. This is not a slow disease. This is not a wait until morning and see how he acts moment. This is bloat, and if you do not act in the next 60 minutes, your dog could be gone before sunrise. So pull up a chair, save this video, and share it with every deep-chested dog owner you know. Because in the next few minutes, I am going to walk you through the exact hidden warning signs of stomach bloat that show up before the belly ever distends, the one breed-specific red flag nobody talks about, the 3 things you should never, ever do once bloat begins, and the simple preventive surgery that can permanently remove your dog's risk of ever experiencing it. Stick with me. This is the most important 60-minute window in dog ownership. Hi, I am Dr. Logan Wells. Welcome back to the channel. Chapter 1. What bloat actually is and why your vet is terrified of it. Before we get into the warning signs, I need to demystify what bloat actually means because most dog owners have a dangerously romantic version of it. They think bloat is just a gassy stomach. They picture their puppy feeling bloated after eating broccoli and passing a little gas. That is not what we are talking about. Veterinary bloat has a longer, scarier name. It is called Gastric Dilatation and Volvulus, or GDV. Let me break those 2 words down for you. Dilatation means the stomach fills with air, fluid, and food, and it physically expands like a balloon. Volvulus is the terrifying part. After it fills, the stomach then twists on its own axis, anywhere from 180 degrees all the way to a full 360. Once that twist happens, the entrance and the exit of the stomach are physically pinched shut. Gas cannot escape upward. Gas cannot escape downward. The stomach is now a sealed pressure cooker inside your dog's belly. And because the stomach is twisted, the blood vessels that supply it are also kinked and strangled. The tissue inside the stomach wall begins to die. Toxins flood into the bloodstream. The stomach presses against a major vein called the vena cava, dropping blood pressure instantly. The dog goes into shock. Without emergency surgery to physically untwist the stomach and clean out the dead tissue, the outcome is death. Not most of the time. Every single time. This is not a chronic illness. This is a race against the clock, and the clock starts the moment that stomach flips. Even with the best emergency surgery in the world, survival rates for GDV hover between roughly 55 and 80%, depending on how much damage was done before the dog arrived. That is why the next chapter is the one that will save your dog's life. Chapter 2. The belly you cannot unsee, and the one that shows up before the belly ever distends. Every dog I have ever lost to bloat came into my clinic at one of 2 stages. Either the owner panicked early and we still had a chance, or the owner gave it an hour to see if it would pass, and by then, it was too late. So I am going to teach you exactly what to look for, in the exact order those signs tend to appear. Phase 1. The silent phase. Before the stomach ever visibly swells, dogs almost always show a sudden, unexplained change in behavior. Your dog was calm. Now he is restless. He gets up, he lies down. He gets up again. He paces. He is glancing back at his hips, looking at his own belly. His ears are pinned. His eyes are wide. He is not wagging his tail. Something is clearly wrong, and he is trying to communicate that to you in the only language he has. Phase 2. The drool phase. Within minutes of the restlessness, the salivary glands kick into overdrive. You will see long ropes of thick, foamy saliva hanging from his mouth. This is the same reaction a human has right before they dry heave. The dog's body is preparing to vomit, but it physically cannot. Phase 3. The retch phase. This is the single most specific warning sign of canine bloat. Your dog walks up to you, opens his mouth wide, contracts his entire abdomen with visible effort, and nothing comes up. Nothing. He tries again. Nothing. He keeps trying to vomit for 10, 15, 20 minutes, and absolutely nothing comes out. This is called unproductive retching. If your dog is repeatedly trying to bring something up and zero food, no water, no foam, nothing is exiting his mouth, treat it as bloat until proven otherwise. We will talk about what to do in a moment. Phase 4, the belly phase. Finally, very rarely the last sign, but the most dramatic, the abdomen starts visibly swelling. In deep-chested dogs, you can usually see it ballooning behind the rib cage first, especially on the left side of the body, where the stomach lives. The belly becomes tight and tympanic. If you are brave enough to very gently rest your open palm on it without pressing, it will feel like a fully inflated basketball. The skin is no longer soft and movable. It is rigid. Now here is what every owner needs to memorize. You do not wait for the belly to distend. The moment your deep-chested dog shows the pacing, the drooling, and most importantly, the non-productive retching, that is when the clock has already started. You have 60 minutes from those first signs to get him through an emergency clinic door. Chapter 3. The 3 things you must never do once bloat begins. I am begging you. If your dog is displaying the symptoms we just covered, do not fall for any of these completely human responses that kill dogs every single year. Mistake number 1. Do not try to burp your dog. Do not pick him up and try to compress his belly. Do not push on his abdomen. I know it feels natural to push, but pushing on a stomach that is already twisted and packed with toxic gas can cause it to rupture inside his body. It can also worsen the cardiovascular shock his heart is already in. Mistake number 2. Do not give him food, water, oil, baking soda, or any home remedy you read on a forum. His stomach is sealed. Nothing is passing through. You are only adding more volume to a sealed pressure vessel. Mistake number 3. And this one hurts me to say. Do not call your regular veterinarian first to make an appointment for tomorrow morning. GDV is not a tomorrow problem. If your regular vet's office is closed, drive directly to the nearest 24-hour emergency veterinary hospital. You can call them en route so the surgical team is waiting for you when you arrive. If there is no emergency clinic within driving distance, find the nearest open veterinary hospital, even a general practice. The only thing that saves a GDV dog is speed, gas decompression, emergency surgery, and aggressive IV support. Nothing else. Chapter 4. Why some breeds win this terrible lottery and why your dog may already be at risk. Now, let me properly terrify you about something. Bloat does not strike randomly. There is a recognized canine anatomy that is at vastly higher statistical risk for this condition. And if you own one of these breeds, you need to take this chapter personally. We call them deep-chested dogs. Picture a dog whose chest is taller from spine to sternum than your hand is wide. Their ribcage is narrow and deep, which gives their internal organs more vertical room to swing and rotate. The breeds I see hit with bloat over and over in my clinic are Great Danes, who carry roughly a 1 in 3 lifetime risk of developing GDV, standard Poodles, especially the tall males, German Shepherds, Boxers, Weimaraners, Irish Setters, Akitas, St. Bernards, Basset Hounds, and Gordon Setters. If your dog's name is on that list, this video is not general interest for you. This is your dog's emergency manual. There are also a few non-breed risk factors that every owner should know. Feeding 1 large meal a day instead of 2 or 3 smaller meals. Eating very fast from a raised bowl that encourages gulping. Exercising vigorously within an hour of eating. Being male. Being over the age of 7. Having a close blood relative, a sibling, a parent who already bloated. If you tick 2 or 3 of those boxes, your dog is statistically in the danger zone, and your vet should already be talking to you about prevention. Chapter 5. The 15-minute preventive surgery that takes bloat permanently off the table. Here is the part of bloat most owners never hear about, because it is the easy part, and scary stories get more clicks. If your dog is young, healthy, and is already scheduled for a routine surgical procedure, such as a spay, a neuter, or a dental cleaning, you should absolutely have a serious conversation with your vet about adding a prophylactic gastropexy. Let me explain what that means. A gastropexy is a quick, minimally invasive 15 to 20-minute procedure in which the surgeon permanently sutures the outside wall of the stomach to the inside wall of the abdominal cavity. Basically, they tack the stomach into its correct anatomical position. Once healed, the stomach physically cannot rotate into a volvulus. It is sutured in place. The stomach can still bloat with gas. The dog can still feel uncomfortably full, but it cannot twist. It cannot strangle its own blood supply. It cannot kill the dog overnight. A prophylactic gastropexy reduces the lifetime risk of a true GDV to essentially zero. In giant breed dogs, especially Great Danes, my colleagues and I strongly recommend this procedure be done laparoscopically at the time of the dog's neuter or spay, while they are already under anesthesia, while they are already healing, while it costs almost nothing extra in terms of recovery. If your dog is on the at-risk list and they have not yet had this conversation with their vet, bring it up at their next wellness visit. Chapter 6. The 5-minute home ritual that catches bloat before it kills. Now, while a gastropexy is a spectacular tool, the truth is that not every at-risk dog will get one. Some breeds, like standard Poodles and Basset Hounds, are notoriously prone to bloat without a clear early signal. So in addition to a gastropexy, I want every one of you to start a 5-minute nightly ritual with your dog starting tonight. Step 1. Sit on the floor with your dog after their largest meal of the day. Watch them. Are they calm or restless? Are they drooling? Are they swallowing repeatedly for no reason? Step 2. Place your open palm flat against the highest point of their abdomen, just behind the rib cage, on the left side, the same spot we discussed in Chapter 2. You are not pushing. You are resting your hand there like a feather. Does it feel soft and doughy, like a slightly squishy water balloon, or does it feel rigid and drum-tight? You are learning their belly's normal texture, so you instantly know when it has changed. Step 3. Watch their breathing for 30 seconds. A bloated dog's chest will heave visibly even at rest. Step 4. Once a week, take 10 seconds to inspect the dog's food setup. Are you feeding 2 or 3 small meals instead of one giant dinner? Is the water bowl elevated or on the floor? Slow feeder bowls cut gulping by roughly 60%, a massive risk reduction. Step 5. Memorize your nearest 24-hour emergency veterinary hospital's address and phone number and save it in your phone right now before you forget. Not the next time you get around to it, right now. Because in bloat, the time you spend scrolling for a hospital is time your dog's organs do not have. Okay, take a deep breath with me. I know this video is heavier than most of what I share on this channel. I know that hearing me talk about a dog being gone before sunrise can hit close to home for many of you, but please hear my heart on this. The goal of this video is not to walk you into another room of fear. The goal is to walk you out of the most dangerous category of dog ownership, the category where we wake up, find the belly ballooned, and feel helpless as we drive to the clinic. You are not helpless. You now know that bloat is not a single symptom. It is a sequence. You now know that pacing plus drool plus unproductive retching plus a tight belly equals an immediate emergency. You now know what not to do. No pushing, no home remedies, no waiting until morning. You now know that some breeds signal this in advance, and you have a 5-minute nightly home check that costs nothing. You now know about a 15-minute preventive surgery your vet can perform laparoscopically while your dog is already under for another routine procedure. That is not just knowledge, that is the single biggest superpower a deep-chested dog owner can carry into tomorrow morning. So tonight, after your dog's dinner, I want you on the floor with them. 5 minutes. Soft hands. Watch the chest. Feel the belly. Inspect the food setup. Save the emergency clinic's number in your phone, right now. If everything feels soft and normal, you get to sleep peacefully, knowing your best friend is thriving. But for that small percentage of nights when the belly feels tight like a drum and the retching produces nothing, you already know exactly what to do. You act in the next 60 minutes. You save the dog's life. And that is what being a hero to your dog actually looks like. Now I want to hear from you in the comments. Does your dog match any of the deep-chested breeds we covered tonight? Have you ever considered asking your vet about a prophylactic gastropexy? Tell me your story below, because your experience might be the one thing that helps another owner recognize the signs in time. And if this video felt important to you, please hit that like button, subscribe to join our family so you never miss an emergency guide like this one, and share this video with every dog owner you know who owns a Great Dane, a standard Poodle, a German Shepherd, a Boxer, a Weimaraner, an Irish Setter, an Akita, a St. Bernard, a Basset Hound, or a Gordon Setter. They may not know what they do not know, and that is exactly who this video is for. I'm Dr. Logan Wells. Memorize the 60-minute window. Save the emergency clinic's number tonight. and I will see you in the next video.